Alright students, let's talk about sexual disorders now. So the first thing that we have to discuss about sexual disorders is what is gender and how is it different from the anatomical sex of a person. So gender is basically the sense of being a male or a female, right? Anatomical sex is all about the organs, what the sex organs are. But gender is what the person considers himself or herself to be. Usually, a person with male anatomical sex organs would also consider himself to be a man. So, anatomical sex and gender are same. Similarly, a person who has female genital organs would consider herself to be a female. So, usually the gender and anatomical sex is same. But sometimes it is not the case. That is not the case. So, if there is a difference between the gender of the person, what the person considers himself or herself to be, and the sex organs, then there is a disorder which is called as gender identity disorder or GID. In the DSM-5, the name has been changed to gender dysphoria. Right. Now, the presentation of GID is different at different stages of life. When the patient is in preschool years, when the patient is a child, the presentation is something like this. So the patient would prefer to wear the clothes which are usually used by the other sex or other gender. For example, if the patient is a boy, he would prefer to wear frocks and skirts rather than wearing the normal pants that usually boys wear. So preference of clothes that is usually worn by the other sex. Not only clothes, even the play activities. The child would try to play with dolls and houses rather than the normal cards and the guns game that usually boys do. So dressing as well as the play activities are of opposite sex. Now, because the patient is a child, he does not completely understand the significance of anatomical organs. So sometimes he may say, the boy may say that he wants to be a girl, but he is not mature enough usually to make a comment on the sex organs. So although he may express a desire to be of opposite sex, but usually he does not make a comment upon the anatomical structures. He would not make a comment upon his penis or testes. So this is how the symptoms start to show up, start to appear. When this child becomes an adolescent or adult, reaches adulthood, then we see the full-fledged presentation of gender dysphoria, which is called as transsexualism. Twice this question has been asked in your All India examination. So usually seen in adolescents and adults. Now what happens is the patient is now in his adulthood or adolescence. He understands most of the stuff. Now he clearly says that he wants to become a member of the opposite sex. Right? He starts saying that he wants to say, again, the patient is the same. Now this boy has grown up. Now he clearly says that he wants to live like a woman and he wants others to treat him as if he was a woman. Right? Not only that, now he also talks about the anatomical sex organs. He expresses discomfort with his sexual organs and he says that he wants to get rid of them. He says that he does not like his penis or testes and he wants to get rid of them. Instead, he wants to get female genitalia, he wants to get vagina and he wants to get breast and he wants to convert into a female. So this is the full-fledged presentation, right? Now, typically in exam, you are given a phrase. The phrase is the patient comes and says that he is a male or he is a man trapped in a woman's body or she is a woman trapped in a man's body. The moment you see this phrase, I am a man trapped in a woman's body or the vice versa, the moment you see this, you should be thinking about the gender identity disorder, particularly transsexualism. The person says that he is a man trapped in a woman's body or the vice versa. In fact, last year I saw a patient. He was in fact a medical student and he came all the way from one of the states, northern states, and he came and he said the exact line. I'll tell you the exact line. He said that, sir, when I get up in the morning, I feel that if by some magic, if the genitals could just disappear, that would be so great. So he just wanted that some magic could happen and his genitals would go away. Of course, he knew what he was going through. He knew that he was having gender identity disorder. But that is the amount of frustration that these patients have. Right? Now, what do? How do you treat this patient? Is it easy to change the mind of this person or is it easy to change the body of the person? The answer in fact is, it is easy to change the body. You would not be able to change the mind. This is kind of engraved in the stone. Whatever he is feeling, he would continue to feel the same way. So if the symptoms are significant, if you're sure about the diagnosis, if for a significant period of time you have done the therapy sessions, counseling sessions, then you can give a go ahead for the sex reassignment surgery, where the sex organs would be removed and the sex organs of the opposite sex would be created. For example, if it's a female, the breast would be removed, mastectomy would be done bilaterally, and hysterectomy would be done, and there can be a creation of neophallus. Of course, you have to give lifelong hormonal therapy. This is SRS, sex reassignment surgery. Now the third variant or third type of GID is something called as dual role transvestism. It is kind of a type with lesser symptoms. Now here what happens is, the person who has this disorder, he would have episodes of cross-dressing. There would be certain episodes where he would cross-dress. For example, a male would wear the clothes that are usually worn by a female. And during those episodes, why is he doing so? Why is he cross-dressing? Because he wants to have a kind of temporary feeling of belonging to the opposite sex. He just wants to feel how would it have been had he been a female. So these episodes of cross-dressing are just to have a temporary sense of belonging to the opposite sex. After the episode is over, the person is perfectly fine. Unlike the transsexualism, this person does not have any discomfort with his sex organs. Also, this person does not have any desire to change the sex. So this is how we differentiate dual role transvestism from transsexualism. But we also know that cross-dressing is also a type of fetishism, right? We have heard of fetishistic transvestism, where people get sexual arousal by cross-dressing. So how is dual role transvestism different from fetishistic transvestism? The answer is simple. This guy is not getting any kind of sexual arousal from cross-dressing. The patient with fetishistic transvestism gets sexually aroused with cross-dressing. So this is what differentiates the two. So this is about GID or gender dysphoria.